This is Taya reporting for the Real News Network in Baltimore City, Maryland. In Baltimore, 2 people a day are dying from drug overdoses, and the city is running out of a drug that is critical to saving their lives. But the question is why, especially in the light of the latest news that the opioid crisis has only gotten worse. A new report revealed that emergency room visits tied to opiate overdoses have soared to nearly 1.3 million across the country, a 99% increase since 2005. That news, coupled with the recently released statistics that overdose is now the leading cause of death for people under 50, only underscores the fact that addiction in the U.S. is now a full-scale epidemic, which raises questions as to how a city agency is running out of the best way to save people who take too much of an opioid, the life-saving drug Narcan. Narcan is what's known as an agonist. It quickly rids the body of opiates which cause respiratory arrest, but the drug's price is skyrocketing just as the need for it grows. Evzio, one of the most popular versions, has had its price increase 7-fold in 2 years and now costs nearly $4,500 per dose. The price for the Narcan spray has skyrocketed nearly 60% since last year, which is why Baltimore City Health Commissioner Dr. Lena Wen made an unusual public plea for more funds from both state and federal governments to keep Narcan available and the addicted out of the morgue. Naloxone, it's the injectable and spray that can save people's lives when they're overdosing on an opioid. Why is the city running out?
Let me start with the background for where we are today. We are facing an unprecedented opioid overdose epidemic. Last year, 2 people died from overdose every single day in our city. That's more than the number of people who died from homicide, more than the number of people who died from car accidents and suicide. This is a public health emergency, which is even made more tragic by the fact that there's one medication, naloxone or Narcan, that can save people's lives at the point that they're overdosing. As an ER doctor, I've given naloxone hundreds of times, and I've seen how someone who is overdosing has stopped breathing and would otherwise be dead. They'll be walking and talking within seconds. Already in the city, we have trained over 23,000 people in the last 2 years on how to use this medication. And everyday people, neighbors, have saved over 800 other people in the city. So this is something that we should all carry with us in our medicine cabinet and our first aid kit. The problem is that we are being priced out of the ability to save lives. The price of naloxone has more than doubled. It's a generic medication. The price has more than doubled. And with the increased demand, with the high number of people who are overdosing, especially because of fentanyl, which is a medication that's many times stronger, drug many times stronger than heroin, because of fentanyl, because of heroin, because of other prescription drugs that are killing our residents, we need Narcan more than ever. And we just don't simply have enough. We don't have the resources to purchase it, and we need the assistance from our state and federal partners to help us to meet the high demand, the high urgent need that there is in Baltimore City.
Now, Governor Hogan said that the opioid epidemic in Maryland is absolutely one of his top priorities. Have you asked him for money?
We at the Baltimore City Health Department have made numerous requests to our state partners for funding. This is a public health emergency. There are tens of millions of dollars of funding that will be released, as we understand from the state. We have not yet received these emergency funds, and there are people dying every day in our city. So we're looking for guidance. We're looking for a continued partnership with our state so that we are able to get the resources that we desperately need in order to save lives here in Baltimore City.
The Bloomberg School of Health said the city would save millions of dollars if there was a safe space for people to use drugs. Do you agree with creating a safe space for people to shoot up?
There are many things that are necessary for us to fight the opioid epidemic. Getting naloxone or Narcan into everyone's hands is one sure way, because people are dying right now, and there is an antidote that's available right now. We should make sure that everyone carries this in their medicine cabinet and their first aid kit right now. There are many other tools that are necessary too. After you save someone's life, they also have to get into treatment, because we know that treatment works, that recovery is possible, and that there are signs showing that there are millions of people who are living in long-term treatment, who are living with treating their addictions, that they're able to resume their normal lives. And we don't nearly have enough treatment to meet the high demand in our city. Now, we await legal guidance from our federal partners, from the Attorney General's office, as to whether safe injection facilities would be legal here in our city. If they are deemed to be legal, then they are one additional tool that we would love to be able to employ once they are determined to be legal and evidence-based.
30 years ago, Mayor Kurt Schmoke said that we should decriminalize all drugs. Last year, Delegate Moorheim said we should decriminalize all drugs. Do you think this would actually help make our citizens safer?
Addiction is a disease. The science shows that addiction is a chronic disease, just like diabetes, heart disease, high blood pressure. We don't incarcerate people who have other illnesses. And incarcerating people who have the disease of addiction and hoping that they'll somehow get better and recover, it just doesn't work. And that's why we've been working with our police department, state's attorney's office, and our other partners on programs like LEAD, Law Enforcement Assisted Diversion, where individuals who are caught with small amounts of drugs will be offered treatment instead of incarceration.
Geez, what other strategies is the Baltimore City Health Department using to help deal with the opioid crisis?
First, we are getting naloxone or Narcan into the hands of every individual because we believe that that is the antidote that will save lives. The problem is that we're running out of funds, and so we desperately seek assistance from our state partners to be able to alleviate this huge shortage. We are having to ration. We're having to decide who are the most likely to die from overdose, and we're giving Narcan to those individuals, but there are still thousands, tens of thousands more people who need to carry this medication with them. Second, we have to increase access to treatment. We're starting something called a stabilization center, which is a 24/7 treatment option for us so that individuals who need treatment for addiction and mental health are able to get help at the time that they need it. And we're also working on increasing treatment options and getting people referrals into treatment. For example, we started a 24/7 phone hotline for anyone with addiction and mental health needs. And third, we're reducing stigma and fighting stigma with science. You can go to any pharmacy, and if you are Medicaid, naloxone is $1. If you are unable to pay that $1, it's free. So we encourage everyone to go and get those resources. Also, our 24/7 phone line will give you the phone number for afterwards as well. I don't have those numbers with me. I will say that we have enough funding through July of 2017 for several thousand doses of Narcan. That's all that we have, though, for all the outreach workers who are on the streets, who are doing trainings, everyone, our needle exchange vans, all of our clinics, all of our nonprofit partners and our federally qualified health centers. That's all that we're able to give to people. We need many more, tens of thousands more. If you give me several thousand doses today, I'll be able to distribute them this week. That's how desperate our need is and how high the demand is in our city for this life-saving medication. I signed 2 weeks ago a standing order. Yeah, so but I'll just mention that anyone can walk into any pharmacy in Baltimore City and get Narcan. They don't need to have a prescription because I signed a blanket prescription for every single resident in our city. So you do not need a prescription. You do not need to prove that you have the training, although we encourage everyone to go to our website at don'tdie.org in order to get training. But you can now go to any pharmacy and walk out with Narcan, this life-saving medication, in hand. Because there are multiple forms of Narcan. The generic form of the Narcan, which we do not show here, but the generic form of the Narcan has increased in price, has more than doubled in price. The other forms of Narcan are relatively new, but one of them is worth thousands of dollars, and the other one is available at about $100 or so, and they are expensive. But they have not increased the price because they are relatively new medications that have just recently received FDA approval.
So the drug companies are really putting you in a bad position, I guess. Well, I mean, in terms of raising the price, this is why the price is because of the drug companies and the price increase, right? I'm just making sure I understand the basis of this crisis.
The basis of the crisis is complicated. Yes, it is true that these medications are very expensive, but we also have to take into account the fact that there is high demand, that there are people overdosing. The number of people overdosing is at crisis proportions higher than we've ever seen. So we have higher demand, and therefore we also need to increase the resources that are available to target this emergency. And we have not yet received those relief resources, even when people are dying everywhere around us.
We asked the Office of Maryland Governor Larry Hogan for comment on Dr. Nguyen's assertion that the state had not released emergency funds. They told us that $10 million of the $50 million set aside for the opiate crisis would be available soon. However, they did not specify when or how much money Baltimore will receive. This is Taya and Stephen Janis reporting for the Real News Network in Baltimore City, Maryland.